In my next program, The Medical Explorer will take you behind the scenes of more interesting frontiers of medical care practices in the Yuba City, Marysville, and other Northern California areas. Till next time, I'm Dr. Robert Peppercorn. Thank you for joining us tonight, and have a great evening. Good evening. I'm Dr. Robert Peppercorn, and this is The Medical Explorer. As a specialist in skin cancer, cosmetic laser surgery, liposculpture, and allergies, and as host of this program, I will take you on an exploration of the medical communities of our Northern California counties and bring you behind the scenes of medical care practices right here in our local areas. Tonight, The Medical Explorer is going to introduce you to one of our area's most highly trained surgical specialists, who has dedicated his career to the treatment of diseases, surgery, and injuries of the hand. Our special guest this evening, Dr. Christopher Damon, will tell us about his unique work in correcting hand problems, ranging from carpal tunnel syndrome to hand injuries and other hand problems that may come from aging and other diseases. His unique orthopedic hand surgery work can do miracles to restore the use of our extremely important hands, and I truly look forward to hearing about his work later in tonight's program. In the pharmacy corner this evening, our award-winning neighborhood pharmacist, Bob Church, will tell us about a long-used mineral supplement that may help relieve the annoying symptoms of the common cold. Is it possible that this simple, inexpensive mineral called zinc may help you get rid of that uncomfortable cold much faster than before? Well, we'll learn the answer to this question and others about zinc in the treatment of the common cold in tonight's Pharmacy Corner. Tonight's program will be extremely timely and informative, and I hope that you'll stay with us for the next half hour. Before getting to our topics tonight, let's take a look at the latest medical news. A new study has shown that some cholesterol-lowering drugs may help to decrease problems with bone loss called osteoporosis. The class of drugs called statins stimulated formation of new bone. The scientists at the University of Texas Health Sciences Center screened over 30,000 compounds to find a small molecule that could activate expression of a bone protein gene in the cells that produce bone called osteoblasts. Surprisingly, the researchers found that lovastatin and similar cholesterol-lowering drugs were the only products that specifically turned on the gene in osteoblast bone-forming cells. The researchers also found that the statins could increase new bone formation by 2 to 3-fold in culture and increase bone formation by 50% when injected into mice. The drugs also increase bone volume by 50 to 90%. Statins have been on the market for more than 10 years, and their safety profile is known. If it can be proven in randomized trials, that they have a beneficial effect on osteoporosis, then that would be a major step forward in the treatment of this disease, according to these researchers. Hopefully the study will stimulate companies to do a large trial to specifically look at the effects of statins on bone growth. It's now time for us to visit our pharmacy corner as we learn the latest up-to-date information on the world of drugs and medications from one of our area's most respected neighborhood pharmacists. Returning tonight in the pharmacy corner is our award-winning registered pharmacist, Bob Church from the Medicine Shop Pharmacy in Marysville. Bob, welcome back to the Medical Explorer.
Thank you.
It's great having you here. It's just time after time we do these shows and we watch the community develop and change. Do you remember coming into Yuba City and Marysville on a Sunday afternoon and you'd see no cars?
Absolutely.
And now you come in and there's traffic from one side to the other?
I think the reason for that is I think they've all come to town to watch the Medical Explorer.
Oh, very, very good. Thank you. I didn't tell him to say that either. Thank you very much. Thank you, Bob. I think it may be all the stores and restaurants and things like that, actually, but thank you. Actually, they could be shopping at your store, but you're not open on Sunday.
That's
so.
right.
You want we talk you into opening on Sunday? No, I don't think so. No. Let's talk about what new things there may be available for cold treatment using zinc. What's going on?
Oh, sure. Well, as you know, colds are probably one of the biggest things that affects our population, and each one of us is probably going to endure 3 to 5 colds a year, and we spend about $2 billion a year on over-the-counter drugs to treat colds, and we lose about 23 million days of work because of colds. So colds are significant.
In fact, can we have new miracles here so I can keep all my employees at work and they can't use that for an excuse to take sick time off? Let's do that. So.
Right.
What would be the ideal treatment for a cold?
I think probably something along a natural product that would diminish the symptoms of a cold, shorten the duration of the cold, not have any toxic effects or any side effects. And quite frankly, I'm not sure that anything like that exists. It certainly isn't anything like that today, but that would be the ideal treatment for a cold.
I would like to have something like that right now and have that here. I mean,
absolutely.
Put it in an IV and I'll just wear it on my arm. I mean, it's just so good to have that to prevent colds if we could do it.
Yeah.
How effective are over-the-counter cold remedies? There must be 1,000 of them that say cold for this, cold this, Tylenol for cold, everything.
Really, and you know, and so many of them have so many products in there. They have cough products, they have decongestants, antihistamines, they have pain relievers and fever relievers. But when you really get down to it and look at it, if you look at just the antihistamine part, antihistamines for colds really don't do a lot because the histamine, it's not released the way it would be for allergies, that runny nose and the sneezing. That isn't caused by histamine release. It's caused by the release of another mediator, which antihistamines virtually have no effect on. You take the nasal decongestant component. Yes, those do have some benefit for temporary relief of congestion, and that's a valid component in cold preparations. But on the other hand, there are people who can't take decongestants because of high blood pressure or other problems. So when you look at them as a whole and the amount of money that's being spent, they're not as effective as we think they are.
I wish they were more effective, I'm sure, you know. That
absolutely, and I don't think they warrant the amount of money that we're spending every year.
Oh, it's incredible. I mean,
to take those products.
You have shelf space in your pharmacy for those things, too?
Oh, yeah, and it's very, very confusing. Very confusing.
Yeah. Well, one of the side effects of antihistamines is drying, so I guess people feel they're getting the benefit of drying up drainage due to the side effect of the antihistamine, essentially.
That's essentially, I think, what they're looking for.
Now, I heard on CNN and on the internet about people talking about zinc being helpful in colds. What's your experience and knowledge about that?
Well, I did some reading on zinc because I have recommended zinc for people for the last couple of years, and basically because people were asking for zinc. There have been several studies done, about 9 that I could find. 4 of them showed positive results. 5 of them showed no better results than with a placebo. So whether zinc actually works, I think the answer, an honest answer to that would be some studies show it does, some studies show it does not. However, I think that there is enough interest in it, and it is not a product that's going to cause a lot of problems, that I think if people are interested in it, it's worth a try.
How do you think it would work? What do you think it would be doing?
Well, in the lab, they say the theory is that it stops replication of certain viruses known to cause the common cold. Now, whether that actually happens in the body, that's a different subject. And as you well know, we have that laboratory side, and then you have to prove that that's how it works when we actually take it, and that hasn't been proved. So from that standpoint, I don't think we really know.
Are there side effects to it?
Yes, primarily bad taste, number one, and most of these are either in a lozenge form or a lollipop form, so it's a sucking type of thing.
What do the lozenges taste like?
They taste, to me, they taste sort of sour and minerally like. They're not a pleasant taste. They have, sometimes they have like a little irritating sensation on your tongue.
Right.
So people complain about the bad taste. Sometimes they have a feeling of a little bit of nausea or a little minor stomach ache.
Can they just swallow a pill? Is there a pill for them?
No, that doesn't seem to work.
Oh, really?
No, and it may be that this is more orally involved, where you're actually placing the zinc in contact with maybe where the virus is in the throat, the mouth, the nasal passages. People have to start using these products when they first start with the cold symptoms.
What are some brand names?
Actually, there's a nasal spray out now called Zicam, which they're using, but as far as trade names, most of these products are just under people's own private label, like Medicine Shop has theirs, Long's has theirs, Walgreens, whatever.
I see.
So I don't know of any like true...
I was just curious.
Yeah, it's just like zinc lozenges. That's how they're labeled.
Is the spray available over the counter?
Well, the spray is supposed to be available, but the interest in the spray has been so great that right now I haven't been able to get the spray.
Wow. And you can pretty much get anything if it's easily out there.
Yeah,
I mean, distributors get it to you the next day.
I just think that the response to the product is greater than the manufacturer has the capability of supplying. But
amazing. Wow. Well, Bob, as usual, very useful and very important information, which I hope I can use myself and try to prevent the colds we all get exposed to every day.
Well, it's worked for me, so I think it's worth a try, you know.
I look forward to trying it, and I hope our viewers will discuss this with you and their doctors when they have questions about colds. And personally, why not give it a try? You know, what really do they have to lose?
That's right.
We look forward to returning to our Pharmacy Corner on future programs. Thank you for being with us.
You bet.
Now, on with the Medical Explorer. I'll bet many of you didn't know that it's not only the powerful brain that separates the human being from lower forms of animal life, but it is the intricacies of the function of the human hand that helps make humans unique. Let's meet our special guest tonight, who comes to us from his office in Marysville. I'm very pleased to welcome Dr. Chris Damon to our Medical Explorer studio. Thank you for joining us tonight. It's a pleasure having you here. I've heard about your work for years in the community and how you've helped repair injuries and do a lot of things to people's hands. But our viewers have heard about the specialty of orthopedic surgery, but they may not have heard about the idea of a super specialist, an orthopedic hand surgeon. I always like to begin by having our guests tell us about their educational background. Can you tell us where you went to college and medical school and how that all carried through?
Sure, Bob. I started at Emory University in Atlanta through college, and did some work in addition as medical school work at the Medical College of Georgia in Augusta, and then went and did a year of general surgery as an intern in Buffalo, New York, and an additional 2 years in Cleveland, Ohio, in general surgery, and then entered the military to get orthopedics experience. I spent 2 years first down in Texas, and then did the true residency, 3/4 of which was at Letterman Hospital in San Francisco. And the 4th year was in the Shrine Hospital in St. Louis, doing some specialized treatment for pediatric hand and orthopedics work. And then 2 years payback in the military at Fort Polk in Louisiana, at which point I was also dragged to Desert Storm as an orthopedist.
You had to go over there. You were in Saudi Arabia for a while.
I was there for 4 months.
Working in the sand.
Yes, and saw lots of orthopedic patients then, very concentrated fashion. And then did a hand fellowship as I left the military in Hartford, Connecticut, with Kirk Watson.
I've sort of lost track with all these years you're talking about. It seems like a lifetime of education. We all know about 4 years of college, 4 years of medical school, and how many years after that to become an orthopedic surgeon?
As peer training, there was a year of internship and 4 years of orthopedics.
So that's 5 years after medical school to become an orthopedic surgeon.
That's right.
And to become a certified hand specialist, how many more years after that?
There's an additional year of training and a hand fellowship, and then you take an exam after you've been in practice for 2 years.
So it's really a unique thing. There aren't that many hand specialists, are there?
No, they're not. They're not.
So the difference then between orthopedic and hand surgeon is that extra year or more of the training, fellowship, and experience, and then being ready to pass that exam, which you've talked about with me for years, and yes. I know you've passed it, so congratulations. We like to have you here in the community with all of these skills. It's great. What are some of the more common medical and surgical problems you deal with on a daily basis?
Well, I think something that's a very common topic and interest of everyone is the problem with carpal tunnel syndrome. That supposedly has an incidence that's relatively high now in the population. About 1 in 100 working people in this country has symptoms or signs of that.
What would be some symptoms of carpal tunnel syndrome?
The most common really is numbness and pain together, which awaken someone at night. And they have to shake
in their hand or in their arm? Or?
Goes in the hand, goes all the way up the forearm, occasionally radiates to the elbow or even shoulder or neck. But primarily it starts in the hand, and they wake up with it at various times of night. It's usually fairly predictable, same time of night every night if it gets bad. And they shake out their hand to try and wake it up.
Wow.
And they often wake up with it at the same usual morning hours. They arise, clicking off the alarm, things like that. It also occurs with other specific fixed wrist activities, such as driving or too much keyboarding or writing. And those are contributing factors, certainly, as people do day-by-day activities.
When they talk about occupational things like repetitive hand motions in typing or other things, is that what might cause carpal tunnel syndrome, or does that relate to other things?
It can relate to other things as well, such as tendonitis, which is almost equally common in my practice. In certain areas more common. However, it should be considered really a contributing factor. There is something in certain patients which predisposes them to get carpal tunnel syndrome with doing things like keyboarding. And in addition to the keyboarding, then they develop the symptoms.
So if they're getting pain in their hands and things like this, that doesn't automatically mean they just have arthritis. They may certainly have this tendon problem or the carpal tunnel syndrome.
That's correct.
And so they may not find that just running out and taking Tylenol or ibuprofen for the rest of their lives is the way they have to go. There's things they can do.
Certainly, there are things they can do.
Now, what if you did surgery on someone with carpal tunnel syndrome? Is it complicated for them? I mean, for you it is, obviously. I mean, not complicated for you, you know how to do it. Yes. But for the average person watching, it would seem like a very complicated thing. After it's done, is the recovery very difficult?
It is usually somewhat difficult because the scar is placed in the palm, and it's always been that way. We've tried to get working into ways around it by doing things with a small telescope called an endoscope, in this case, outside of a joint, which involves smaller scars which are generally not placed in the palm but just at the wrist crease, in the front of the wrist. However, the tenderness is still there in the palm, and that's the big difficulty people have getting through this sort of procedure. That tenderness usually is associated with swelling and some redness, and that peaks at approximately 5 to 7 weeks after the surgery. And until then, it's hard to get stronger grasp. People who do heavier activities have trouble up through and a little bit past that point. Most end up wearing a bit of padded glove, like a bicycle glove or some such, until they get the tenderness to go away completely. It usually takes about 6 months for that to happen.
When they talk about carpal tunnel, maybe you could show us on your wrist what that means. People think of tunnels on a highway, or
sure.
I mean, what would that be? The carpal tunnel?
I had planned on bringing something, but did not.
Okay, that's
and the tunnel is actually in an area of the palm which is bounded by a ligament which goes across from here and from here between two sets of bones. It's down approximately 3/4 to an inch deep below the skin, so it's in the back half of the hand, looking at it from the side, and it's not truly in the wrist. The wrist bones go out to about this area, but this is a boundary where there are tendons that go through, 2 that flex each digit, and 1 for the thumb, making 9 tendons, plus a nerve which supplies usually the thumb side of the hand only with sensation. It also does some of the power to the thumb, and that's something that I check along with sensation when I see someone to evaluate that.
So when they say the tunnel, it's actually made up of the different structures as nerves and blood vessels go through that little opening?
Yes. It's below a ligament that crosses that area, and if you looked at it sideways, it would be bounded on the back and sides by the bones, which are the wrist bones, and that's the tunnel.
And that tunnel squeezes down, and you've got to help get it back open again.
There can be, yes, there can be problems with things inside it, or the tendon surface, which is surrounded by some tissue, can cause inflammation. We call it tendonitis. It's really a lining membrane of the tendons,
now
and the nerve is there.
These structures are all packed in there, and they're small. Do you use magnifying glasses and microscopes and things sometimes, or how does that work?
We sometimes do for hand surgery. In this area, though, generally most hand surgeons, as well as regular orthopedists or neurosurgeons or an occasional plastic surgeon or general surgeon who does hand surgery as well, will not usually use magnification of any sort. There are two major kinds, one by a microscope and the other by wearing loupes, similar to that which a jeweler uses but attached to glasses, so that both are involved.
I guess I've seen them using the microscopes when they're like putting blood vessels back together after an injury and things like that, so that's what I was thinking about. Now, in fact, you know this, where I woke up one day and I couldn't move my finger. It was the strangest thing. I saw my life flash before my eyes as I thought I'd never be able to stretch my finger again. It locked in one position, and for 3 hours that morning, as I was trying to get up in the morning, you know, with that finger stuck, I said, am I on disability now forever because of my finger? And so I called you, and you told me not to worry. Tell me what was going on, what we did and everything.
Well, you happen to have a very common type of tendonitis that goes into a finger specifically. It usually occurs in the center two fingers, the middle and the ring finger, and next most likely the thumb, but it can occur in any one. And it's called a trigger digit, as a general common term. It involves inflammation of the tissue that's around the tendon out at the level of the base of the finger or thumb. And it can cause enough inflammation to make a narrowing in that tunnel where the tendon goes out to the digit to actually cause it to catch or lock down, to trigger per se. And it's treated by, as we did with you, anti-inflammatory medication to begin with. If it's not severe, if it presents pretty late in the course of the problem, then to go directly to medicine by injection as steroid medicine, similar to cortisone, is used. It has to be placed right in the beginning of the tunnel. It's not a very comfortable area to get injected, but the relief can be amazing.
It was. I mean, see, I can move my hands now, and they work, and I can do surgery and type on the computer. You saved me there. Thank you very much.
It usually does respond to that sort of medication treatment.
It's a true testimonial of success here. Thank you. I do have to say the shot did sting for a second, and you certainly warned me about that. They didn't have to tie me down, though, but you did warn me about it. So, your work being surgery, and it's, as I said, complex surgery because there's a lot involved in protecting the vital structures and everything. You don't do that in your office usually? It's usually done in the hospital or a surgery center?
That's correct. In fact, none of the surgery that I do is done in an office setting. Some physicians do. Even the most basic of treatments, such as the previous examples, carpal tunnel syndrome, or if needed, the trigger finger, if a small incision is needed to release that for those few % of people who don't respond to the injections. That's done generally with the help of an anesthesiologist because at least some sedative is needed in monitoring the patient. And in hand surgery, we routinely use a blood pressure cuff, which we still call a tourniquet, but truly is set at a specific blood pressure level to not allow fluid in the hand. And so the surgery is done in a bloodless field. No blood is ever lost to easily determine and visualize these very important structures. But that is uncomfortable in and of itself, the blood pressure cuff, after only a few minutes.
So that you have the numbing effect, they don't even feel that? Is that what happens?
That's right. It's either under a local anesthetic done in the forearm or at the axilla, the armpit, placed, called an axillary block, similar to a spinal for the legs, or with just a light general or so-called twilight anesthetic, which is done with just knockout medicine.
Like conscious sedation,
yes,
you call it.
A little bit deeper than that. Pain medicine and knockout drops in the IV, and some oxygen to breathe generally is all that's needed for that level.
So you'd be in your office in Marysville at Sutter North, someone would come in and say you have this problem, you would evaluate them, perhaps look at x-rays, do what other studies you might need to do. You then have a very specific physical exam that you would perform to determine what the findings are in addition to those studies.
Yes.
And then at another date you would do the procedure and set it up.
That's right.
That's pretty straightforward. How would patients come to you if they need it? Can they just call up on the phone and get an appointment?
Well, certainly some can. It more depends on their insurance and what their other issues are than the specific problem, although, of course, my practice is limited to hand surgery and then the wrist Certainly the forearm and elbow is the effect the way the hand works. I do some work at the elbow level, not uncommonly, like the tennis elbow problem.
Oh, interesting. Okay.
Yes. But generally the patient's physician would refer, your family doctor would refer you in to see me. I would, if necessary, evaluate what sort of workup has been done before seeing them and give the family doctor some ideas to what to complete perhaps before I can see them, or to make it as smooth as possible to have me evaluate them so that they don't waste any of their own time as a patient and having to come back to see me for other studies and things.
Right.
I try to make everything all done at once as a consultation, and then if the treating doctor, the family doctor, wants to continue the treatment, then certainly that's fine. I'll recommend some things. Generally, lots of hand problems are things that are esoteric enough, complicated enough, that even regular orthopedists don't handle many of them, and I do continue to follow and treat a bulk of the patients who are referred to me.
One interesting problem that patients actually mention to me, usually it's like a secondary thing. They'll come in for their skin cancer and say, by the way, I've got these lumps on my hands, the tissue is sort of thickening, and all of a sudden they'll say that their fingers are flexing and they can't quite get them back. They're not stuck. They just can't go back like they used to go. So they get these thickenings and the fingers aren't moving. What could that be?
That's most likely, depending on someone's history and how long it takes to develop this problem, especially if it's involving the ring in the middle, the ring in the small fingers usually, something called Dipatrans disease. A Frenchman who first described it over 100 years ago. It involves a disease of the fascia, the connective tissue, which is above the tendons, closer to the skin, and it also can pucker the skin, and it can attach across joints, and that's what produces this gradual contracture or inability to straighten the digits. That's a difficult problem to treat. It generally is one that involves not just that soft tissue, but it wraps around the blood vessels and nerves and distorts them from their usual position in the hand. And we've found very poor success rates with any treatment besides generally cutting out the diseased tissue when it does produce enough contracture of the digits that someone loses function. And that's the only true indication at this time for surgery. There are no other treatments right now that are statistically proven to help in most patients in any case.
Well, sometimes you might, though, even be able to do before surgery the injections and things, too, to calm it down?
Sometimes, yes. Steroid injections below the skin into the nodule, the bump, or the pit area in the palm can help with pain, but it's not known to change the natural history of the disease.
Develops. I see. It still progresses.
The contracture will still occur if it's going to at a future date.
Well, I've seen some work, though, where you've been able to get them to have their movement back and to be able to extend, so you do some good things that way. So it doesn't mean someone has to give up and live with their hands doing that.
Definitely not.
That's great. What happens to a person's hands when they age and they start getting lumpy and bumpy around the middle of their hands? I guess people call it degenerative sort of arthritis. What's going on there?
It truly usually is degenerative arthritis. The most common arthritic pattern of the hand is degenerative. There are inflammatory sorts, the most common of which is the rheumatoid type. Degenerative arthritis rarely occurs in these first joints, though, the big knuckles. Its most common distribution is either in the wrist, at the base of the thumb, or in these middle or end joints. And there are some things that can be done about that if people have significant pain or loss of motion. Anti-inflammatory medicines, the non-steroidal type, can help with early treatment. The American Society of Rheumatologists in this country, though, recommends now going to basic Tylenol for the first line of treatment.
Are you able to actually do surgeries to help certain things in that, too?
Oh, sure. If these things fail, and then steroid injections, which is the next line of treatment, fail to those joints, the middle and the first or proximal joints can be replaced with plastic ones.
And you do all that sort of thing?
I do all that,
That's
too.
Great. Unfortunately, our time's running out, and I'd like to thank you, Dr. Damon, for joining us here on the Medical Explorer. Perhaps we could talk you into letting us bring our cameras over to the operating room and actually watch one of these surgeries sometime, and maybe do that?
That would be good.
We look forward to having you back again. Thank you very much.
Thank you for having me.
Pleasure. Well, that's our program for tonight. I'd like to invite you to write to me at my dermatology, cosmetic laser surgery, and liposuction office in Yuba City with your suggestions for areas and people that you'd like to see here on this program. I'm always interested in hearing from you, and I hope that you'll suggest to your medical doctor or other healthcare professional that you'd like to see them here with me on the Medical Explorer. As you know, we are a public service program, and we really do want to hear from you with your comments and suggestions. Please write to me at the Advanced Skin and Allergy Medical Group at 350 Del Norte Avenue, Yuba City, 95991. Or you can check out our new updated webpage on your computer by logging on to www.bestlasers.com. And like Dr. Damon, you can send me email and we can talk back and forth and anything else you'd like to chat about. Only nice things, though. So check us out on the computer. In my next program, The Medical Explorer will take you behind the scenes of more interesting frontiers of medical care practices in the Yuba City, Marysville, and other Northern California areas. For all of us here at The Medical Explorer and Cable Channel 5, I'm Dr. Robert Peppercorn. Thank you for joining us this evening, and have a great night.